Hi, this is David Rowe from Rowe Chiropractic offices, and we have a patient with us today, Chris, who's been kind enough to share with us his experience, and it's a great example of what we've been talking about, how posture and low back pain are intimately related. Now, Chris's posture, remember we talked about that normal posture, we should be straight from the front view. From the side view, we're supposed to have slow sweeping curves. Those curves are our shock absorber in our spine. Now, Chris has a unique pattern, we say pattern like a direction of misalignment, that his cage, this, is shifted to the left, and it's backward this way. There's also another piece that makes it just a little bit more complicated, is that his pelvis goes this way and his cage goes this way. Now, this complex pattern of misalignment puts stress on one particular disc on the very bottom of his spine, and that's where the low back pain comes from for him. It's the postural misalignment that stresses the disc, that causes the inflammation, that puts stress on the nerve, and that's where the low back pain comes from. So if his cage is like this, we're going to come up with a strategy to push his cage to the right. If his pelvis is twisted this way and his cage is twisted this way, we're going to go opposite of that to correct that. It all makes logical sense. But there's this other piece in it, is that the individual disc was under stress for so long, this disc on the bottom, that we're also going to adjust that one disc to take the stress off of that so the nerve can heal and his body can perform better and function better, and that's what will cause the low back pain to go away. And at the end of this all, we'll do some therapeutic exercises that Chris does daily, and then we'll show you the in-office traction, and here we go. Okay, so Chris, if I could get you to lie left side down and just loosen your belt button zipper. Yep, and we're going to have you lie left side down. Yeah, that'll make it easier for us. It's good. So, because Chris's pelvis is turned this way and his cage is turned this way, we're going to go ahead and make a correction. So we're putting him in a position like that. Now the disc that's swollen is this bottom vertebra right there. So we're going to just put our hand directly on that one disc. We're setting this up in a typical 𝒂𝒊𝒏 adjustment. And Chris is going to help us. And he does half of the work. He just stretches, and then I'm just going to set the one disc like that. Oh, you're a rock star. That was awesome. Fantastic. And when you get up, just be careful. Swing your feet off and push up. That's great. Good. That was awesome. Let's go right side down, and we're going to fix the translation part of it. So if you lie on your right side, but we're going to use this block to assist us in a typical chiropractic biophysics adjustment. And you lie on your right side. That's good. Good. We have his pelvis lifted, and Chris's cage, his subluxation, is up in the air to the left like this. So we're going to create a correction where he pushes downward. Great. Now we're going to lift this, and he's going to press down and push the cage down. He's activating all of his muscles, stretching that beautifully. And then I'm just going to give a little nudge at the end, like that. And let's do that one more time. You did great. Let's just press that down. Stretch that tissue down. Stretch that tissue. Beautiful. One last time. Good. Push the chest down. Push. Brother, you're doing great. Excellent, Chris. Good job. Push up. Swing your feet off in front of you, just like that, and roll right off of that. Fantastic. Okay. So we've got the rotation corrected. We adjusted the disc. We've adjusted the cage translation to the right. The last piece of this is that Chris's cage goes this way, and there's one specific vertebra in his 11th thoracic here that is constantly under stress. It gets resubluxated. So we're going to push him this way and then adjust the 11th thoracic. Now Chris he's a master organ player, and so sitting on the instrument, it's common, although he has worked diligently to correct this, but the tendency is that the body would sink down when he's doing his, you like my rendition of the organ playing? Yeah. So that his cage will go this way, so he's always pushing like that. Well, we're going to create an adjustment that's going to help him with that. So if we go face down, and you're going to put your pelvis on there, and we're going to once again go opposite of pattern, and then adjust the individual segment. Fantastic. Good. So good. 7, 2, Okay, so let's look at the setup. We've got his pelvis back, his feet forward. He's pushing his cage forward like that just to stretch that out. And then we're going to take just one vertebra, and Chris is going to press forward, and I'm just going to find his timing and set this one vertebra. Fantastic. Good for you, man. Great. So we go opposite a pattern, and then we set the one disc.